This one page can replace the 2 hours of study in 30 minutes. So this is the topic of the diarrhea. So I'm going to use the code OAC alpha OAP. This is the code, and in another video we will make the oral rehydration. But now, what is diarrhea means? Increasing in the liquidity of the stool and decrease in the ability to absorb the intestine. We have to remember this code, but what is OA refers to means opioid agonist with loperamide and diphenyl oxalate, and will be stimulating the mu and the delta receptors of the morphine receptors, so which are located on the intestine. While the mu will be decreasing the motility and the delta will be decreasing the intestinal secretions. The main problems in the diarrhea are increasing in the motility or the peristalsis and increasing in the secretions, and because of the secretions the liquidity of the intestine are increasing. So we have to work on these two things, letting the receptors of mu and the delta. The mu will be decreasing the motility and the delta will be decreasing the intestinal secretions. So it also affects on the CNS, useful for the travelers. So side effects like abdominal discomfort and the dry mouth. So coming to the anticholinergic drugs, they will be decreasing the bowel motility. Normally, the M3 receptors are responsible for the increasing motility and increasing secretion. So, blocking M3 will be decreasing the motility and secretions of the intestine. So, it is moreover acting same like opioid receptors, but it is in a different way, like blocking the receptors. This is stimulating the receptors. So, coming to the alpha adrenergic receptor agonist, going to stimulate the alpha 2 receptors, which is a GI receptor, which is inhibitory of the release of the neurotransmitter. So, when the agonist given, ACH release paused. Because of that, the decrease in the motility and decreasing in the secretion, increasing in the absorption and increasing in the intestinal transit time. The time that takes for the food to cross the stomach increases. Side effects like blood pressure decreased due to the decreasing in sympathetic flow. That is, the neurotransmission decreasing causes the lower blood pressure. Octreotide is an octapeptide synthetic 8 amino acids containing compound, which is act similar to the somatostatin. It acts like an somatostatin, but the somatostatin lives for only 3 minutes in our body, but the octreotide, which is similar to that action, which stays 1.5 to 2 hours. So octreotide actually inhibits the growth hormone, glucagon, insulin, gastrin, motilin, and glucagon, secretin, and 5-HT3. So octreotide is like decreasing the GI motility, decreases the intestinal fluid. Somatostatin, GI also works similarly, decreasing the secretions. The octreotide works like similar to the somatostatin. So absorbent drugs like kaolin, pectin, and magnesium aluminum silicate used as an indigestible purified carbohydrate, which is extracted from the apple and absorbs the bacteria, increases the consistency of the fecal matter. So because of increasing the consistency in the fecal matter, the liquidity will be decreasing and the absorption will be enhanced. Bismuth and the subsilicate decreases the stool frequency and liquidity, coats the inflamed GI mucosa for the travel diarrhea, acts systemically. Coming to the probiotics, which is lactobacillus sporangium and vitamin B complex. So it will replace the normal bacteria flora present area, which is caused because of the antibiotics, which is loss of the bacteria. This is going to replace the normal bacteria which is present in our GIT, and used for adjuvant therapy for the diarrhea and helps in the digestion of lactose, responsible for bringing the water into the intestine. So the reason for the diarrhea is the lactose. So this lactose is going to be eliminated, so diarrhea can be eliminated. Mainly decreases the liquidity